Your dentist might save your life before your doctor can actually see it. Do you feel breathless at night? Well, your mouth can reveal that you have sleep apnea. Before I get going, make sure you put code DENT 84, DENT 84, and make sure you like, subscribe, and share this episode. And we are so honored today to have my mentor, Dr. Decicco. Hi, Dr. Decicco. How are you today?
Hi, good morning. How are you doing?
Wonderful. I am so excited and honored to have you today. And just a quick, let me tell you, Dr. DeSico is one of the top sleep dental medicine expert in the country, and she's my mentor. So I am very pleased to have her today. And I'm honored, Dr. DeSico. So tell us a little bit about yourself.
So, yes, I've been doing dental sleep medicine for about 15 years, okay? And you were very generous saying top in the country. Certainly, I've been doing this in New Jersey, okay? And I was first introduced to it over 15 years ago, but I've been a general dentist for going on 40 years. And I always was very interested in the health of our patients. And it was a natural progression when we started to learn about sleep apnea that we should be concerned with our patients when we saw things that led us to conclude that they indeed might have it and it was undiagnosed.
So
But
what
I am,
made you, yeah,
yes.
what made you really interested in that?
Well, the thing that really got me interested in it is I had learned about it. I was always interested in oral medicine. I had learned about it, but then actually my mother had it. And when she was sick and in the hospital, all of a sudden they put her on a CPAP. She had never been diagnosed before with it. It was only when she had some type of critical thing. And she was elderly and she was a little bit overweight. And that got me more interested in it. And then the more I learned, the more I realized that it's the leading cause of strokes, it's the leading cause of heart disease. And it really wasn't taught to us in dental school because at that point they didn't realize that. This is all new information. One of the first courses I took, which was over 15 years ago, I actually met the the physician who initially got sleep apnea recognized by the American Medical Association as a real disease and a real condition. Before then, it was not even recognized. And he did research and actually got them to recognize it. And after that, the research started to explode.
So, and since then, you've been saving lives because sleep apnea can actually kill people.
It does kill people. And more than just killing people, because people used to think only sleep apnea related to people who are elderly and overweight and they die in their sleep. But actually, it decreases our our lifestyle. It affects people who don't even know that they're sick, and it decreases their quality of life in my dental practice, when I realize, people go through questions and you ask, how are you feeling? How are you doing? And how many people would say, oh, well, I'm tired and, I'm just feeling stressed. But really, they weren't sleeping well at night. And sleep basically is needed for people to be healthy. And if they don't have good sleep, they're not going to be healthy. As
That
a
is,
dentist,
Mhm.
one of the things, my first visit with everybody, as most dentists, is we look at their mouth. And all of a sudden, we're noticing things that are direct relationship to the fact that they have sleep apnea. And we had no idea. I had no idea about sleep apnea when I went through dental school. And in my dental practice, I did see people who ground their teeth and damaged their teeth, causing their teeth to crack, causing their teeth to wear down and become sensitive, causing them to lose their teeth. And we just thought that this grinding of their teeth or clenching of their teeth was due to stress and
Mhm.
habits. And people were put on medications to relax them. They were told to meditate. They were told to, just relax, take a vacation. And
True.
that did not help. That was not the answer. And we put people in night guards. I probably had half my patients in night guards to protect their teeth from cracking because they clenched. We had no idea that the reason they were clenching and grinding was really because of a medical condition called sleep apnea.
So for our listeners now, how can they tell if they have sleep apnea? Like what are the signs?
Well, first, I think a definition of sleep apnea might be appropriate.
Mm-hmm.
Um, Sleep apnea, people hear about right now, but what it means is that when you're sleeping, you're you stop breathing for up to 10 seconds. 10 seconds is a
That's
long
a
time
lot.
to
Yeah.
stop breathing, okay? Or you just don't have enough oxygen that gets to your brain for up to 10 seconds, okay? And and so that's sleep apnea, okay? And and when we look in the person's mouth, when the body is trying to struggle to get more oxygen, we do certain things and we're asleep. And one thing we do is we tighten our muscles and we're
True.
asleep. That's why we clench. Okay. And as the muscles tighten and as we grind our teeth at night, it opens up, the muscles get tight, so a little bit more air gets through. So they're able to get a little bit more air to their brain. Okay.
Mm-hmm.
The body, when we're asleep, needs oxygen, and it's the brain that needs the oxygen. So when the brain isn't getting the oxygen, then the reflex to tighten our muscles and clench and grind gets initiated. And that's pretty powerful to know that it's your brain that's doing this because it's starving for oxygen. Okay. Other things that can happen when we look in their mouth, we see the things that could have contributed to this, okay, is we look at someone and maybe they have a small mouth.
Mm-hmm.
So maybe they had to have teeth removed as a child in order to fit their teeth in their mouth as they grew. That already predisposes them to
Mm-hmm.
having a smaller airway so they can't get enough oxygen, okay? Maybe their tongue is a little bit large, just like people vary from person to person. Some people have big hands, other people have big feet, other people, and some people have big tongues. It's nothing wrong. It's just what our genetics did. And somebody could end up with a larger tongue and a smaller mouth, okay? And and when we go to sleep, when we're during the day, we're breathing just fine. But we don't realize that when we go to sleep, the body changes. All our muscles will relax. And the tongue is a huge muscle. And when the
Mm-hmm.
tongue relaxes, it's attached to the back of our throat. And it goes back to the back of our throat when we go to sleep. And
Mm-hmm.
if our throat is small and our tongue is large, we can't breathe. So these are all things that when I look in a person's mouth, when you look in a person's mouth, we immediately see, oh my gosh, um, the tongue is blocking the back of the throat. I
Yeah.
can't even see the airway. Usually we can see the airway. I don't know, but we see patients that sometimes they say ah, and you can see the
Mm-hmm.
back of the throat. It's
That's
huge.
true. That's
Okay.
so true. Yeah.
And we know that that's great when we see that.
Mm-hmm.
But if a person, you have to like push their tongue down to be able to even see the back of their throat as we do a cancer exam of their back of their
Mm-hmm.
throat, their airway is not big.
Mm-hmm.
Other things that can make their airway even smaller, okay, is I'll look in the back of the throat and I see huge tonsils. Those tonsils are so swollen that it blocks the throat.
Mm-hmm.
And some doesn't mean that everybody have to have their tonsils out, but it's just a factor that can make their airway smaller. The other thing is we look at the back of the throat. If anyone looks in their mouth in the mirror, they might see something hanging down from the roof of their mouth.
Mm-hmm.
Okay. That's a uvula.
The uvula.
I wonder how many people actually know that it's called a
Yeah.
uvula. It's a funny looking thing. Okay.
So I'll just tell, so people who are listening to us on Spotify or iHeartRadio or Audible, we are also on YouTube, guys, if you want to see what we are talking about. So basically, the uvula, you can go to the Wonder Tooth podcast on YouTube and you can find us there as well. But basically, all the way in the back of your throat, if you stick your tongue out, you're going to see your palate, basically your soft palate. It looks like almost like the top of the heart shape. And this is the uvula. That part is like the little dangling thing. It looks like heart shape. And then you see the back part. If you don't see that, there is a big possibility that you have an airway obstruction.
Yes. Yes. That's one of the main main signs that we see when we look in the mouth. We see that we can't see the uvula.
Mm-hmm.
And sometimes we can't hardly see the teeth because the tongue is so large that
Mm-hmm.
we can't even see the teeth. Other times when we look at the tongue, we see the tongue has scalloping, which means that it's like a around the corners of the tongue, there's little indentation.
Indentations, yeah.
Yes, and
So you
those,
guys, yeah, you when you go in the mirror, you guys, you should do that now. If you are listening to us or you're watching us, go check your tongue in the mirror. Stick your tongue out and look. If the mark, like basically the outline of the tongue, if it looks like nice and smooth, you should be okay. But you also stick it out and try to look all the way in the back. Maybe you can get a flashlight and look. If you see that little tiny dangling thing, you might be okay. If you start to see everything is closed and then you see little indentation on the outside of the tongue closer to the front teeth, you might have like what we call a scallop tongue, right, Dr.
yes,
Decicco?
absolutely. And that scallop tongue is caused by the tongue pressing up against your teeth when you're clenching at night. Just like if you were wearing a wristband that was tight, it would
Mm-hmm.
leave an indentation in your wrist. When your tongue is pressing up against your teeth, we see the indentation of your teeth on the side of the tongue. That's how much pressure you're putting in at night, or in some people during the day. So that jumps out at us, okay, all the time.
Yeah.
The other thing we may see is you're always having your dentist check your mouth to make sure that you don't have oral cancer, okay?
Mm-hmm.
But one of the things we see is we might see redness on your cheeks or even sores on your cheeks. And you may be actually damaging the sides of your cheeks just from the grinding that goes on at night. And that grinding, or what we call bruxism, may be also it's a sign that you may have sleep apnea. So these are all things that as soon as I look in someone's mouth and I haven't even, maybe I didn't even read all through their history, okay?
Mm-hmm.
I can ask them and say, "Hey, do you wake up with headaches?" Because many of these people will also wake up with headaches and they'll say, "Oh, how did you know that I might wake up with headaches?" Or I might say to them, "Has anyone told you that you snore? Do you know if you might snore at night?" And they'll say, "How did you know that I might be snoring at night?" And we see that the uvula is swollen, okay,
Mm-hmm.
and red, okay. So immediately it's like we're forensic dentists. We're sort of
Yeah.
getting all these clues
Yeah.
as to what's happening that the person doesn't even know is happening.
Yeah. And also medically, it can sleep apnea can medically affect the patients, right?
Oh my gosh, sleep apnea affects us in ways that we never have any idea about because in sleep apnea, you're not sleeping well. The role of sleep has to be understood, and everybody has heard about REM sleep. Okay, that's rapid eye movement sleep. REM sleep is only 25% of our sleep. But we need it because that's when the brain heals. Our brain heals during REM sleep. The other 75% of our sleep, provided we're going into deep sleep, is when the body heals. So there's different sleep stages, but if you never have REM, your brain is never healing. Okay. And if you never get into deep sleep, which is the what's called N3 sleep, okay, third stage of sleep, you only have to be in that 25%, but that's when the body heals. But if you constantly wake up at night, or you just never get into that because you're not sleeping well, your body never heals, and the purpose of sleep isn't achieved. The body and the brain isn't healing when you're sleeping.
And sometimes it can lead to high blood pressure.
Yes. Actually, sleep apnea is the leading cause of strokes in the country. Okay. And actually, 92% of people who have strokes when they're asleep, it's directly related to them having sleep apnea. Okay. It's also the leading cause risk factor for people who develop heart disease. It is a bigger risk factor than smoking. It's a bigger risk factor than obesity. It's a bigger risk factor for hypertension. On its own, sleep apnea itself is the largest risk factor for cardiovascular disease. We didn't used to know that.
Yeah.
Okay. And yes, it is related to hypertension or high blood pressure. If a person is on sort of the brink of having high blood pressure, okay, it could put them over the edge and all of a sudden they have high blood pressure and they need medication.
Mhm.
Okay. If they um, uh, on the brink of having diabetes, it's going to make diabetes worse. Okay. Um, there's factors that are now showing the research that it can actually lead us to Alzheimer's disease and dementia. That's the brain part that's affected. If you have acid reflux, and many people have acid reflux, and they just think, oh, it's what I ate last night, you know, I just have it. I'll take my you know, anti-acid reflux medication and I'm all right. But you're not, because the reason you may have acid reflux is that, remember we were saying how the muscles all tighten because the body and the brain needs oxygen? Well, it's not just, the mouth muscles that tighten, it's the esophageal. The
Mhm.
esophagus muscles tighten. That whole area tightens, okay? And we're asleep, and as it tightens, you get acid reflux. And that's from the sleep apnea. So there's a direct correlation with many, many things because our body is struggling at night. Instead of resting and instead of healing, it's actually causing our time at night to be damaging our system and causing these other diseases.
Yeah. So how can people like identify that? Like how can we help the listeners or the viewers to know or basically to go seek attention, like medical attention or
Yes.
dental attention?
Yes, the first thing is just here, just being aware that, oh my gosh, I wonder if I have sleep apnea. Am I waking up at night? Am I not sleeping through the night? Am I waking up more than once? Once a night is probably normal to go to the
Hmm.
bathroom for many people, but more than once a night is not normal. Am I waking up tired? And I was in bed for 6 hours, 8 hours, 9 hours, but I'm still tired and I feel like I'm dragging myself through the day. I need that coffee just to get going every morning, no matter how much sleep I get. You got to say, oh, maybe I'm at risk for sleep apnea. And so you need to talk to your physician, or if you have a specialist who's a pulmonologist, well, your primary care, you don't need a specialist, but the primary care can
Hmm.
actually have a sleep test taken for you.
Yeah.
We do home sleep tests or home sleep screenings. Some people hear about going to a lab. That's not needed just to diagnose you, you
Yeah.
know. But a home sleep test is so easy today.
Hmm.
People say, "What is a home sleep test?" They're afraid of it. It's pretty easy. You're
Yeah.
you're sent home. Sometimes you're sent home with something that looks like a big wristwatch,
Hmm.
okay? That connects to your finger, okay? Sometimes it's just something you strap around your chest, okay? That connects to your finger. But it measures your oxygen at night. It measures sometimes your sleep stages at night. It measures things that lets us, the doctor, know whether or not are you at risk? Do you have sleep apnea? And from there, you can have treatment for it.
Yes. And your dentist also can kind of tell you, okay, I think you should be referred, you should get a sleep study done.
Absolutely. Yes. Yes. Your dentist is the perfect one to say, hey, do I have risk factors for sleep apnea? And if you do, you need to have that addressed. You can't just say, oh, okay.
Yeah.
You have to act on it, you know?
Yeah,
You don't want to
absolutely.
wait till you get sicker. You might already
Absolutely.
be on blood pressure medicine. You might already have diabetes. But if you don't want to wait till you do. And if you have it, you don't want to wait till it gets worse.
So
So,
true. So true.
yes, yes.
Well, that was part one of our amazing episode today. There will be another episode, so stay tuned, and it's gonna come again. And make sure you follow and like and subscribe and share this episode, especially if you or your loved ones specifically are snoring, or if you wake up in the morning and you feel tired.
Yes, absolutely.
That was amazing, Dr. Decicco. Thank you very, very much. And make sure you take care of your teeth so that they can take care. We'll see you
Yes.
again soon, guys. Keep smiling with Dr. Saad.